Hi friends, welcome back. My name is Mavish. I am a dentist and today I'll be sharing some really amazing tips to help you work faster and efficiently as dental professionals. Alright, before we move on, let me tell you that these tips are not from any book, but it's actually my learning experience that I have gained over the past few years, and I'm hopeful that it will make a difference to you as well. Please do not forget to subscribe to our channel to get all the latest updates regarding our new videos. So, whether you are practicing dentistry in any part of the world, time is precious. Especially in UK, if you see NHS dentistry runs at a really fast pace. Now, this doesn't mean that you should rush, but yes, there are a few things that you can do to save time. So, why should you work fast? Firstly, you can treat more patients, obviously, and you will learn more. Of course, you get more exposure, you see more new cases every day, so definitely you will learn more, isn't it? At the same time, you can earn more because particularly in UK, dentists are usually paid on UDA basis, so that is unit per dental activity. So the more you work, the more you earn. Simple as that. So obviously you will save more time, and definitely time is most valuable thing because once it is lost, it will never return. Tip number 1. Prepare specific templates for each procedure. Now, good record keeping is really important, not just from the patient point of view, but even for yourself, because only your records can tell us what you have done for the patient, what you have warned the patient for. So particularly in case of any legal problems, only your records can act as a proof and can save you from any legal issues. So it's really important to have good records. But the problem is that if you start making notes separately for each patient, then it's going to take very long time. So what I suggest is that you prepare specific templates for each treatment, such as examination, conservative treatment like fillings, scaling, polishing, periodontal treatment, extraction, prosthetic treatment such as for denture, bridge or implant. So what you can do is, once you are done with the treatment, copy and paste the template, and then you will have to edit it according to the patient's need. Okay. Tip number 2. Organize your treatment plan. Now, even before the patient walks in, just go through the treatment plan that you have prepared for the patient. Now, let's say that in one patient there are multiple treatments. For example, the patient comes with periodontitis, so they require a proper charting for the periodontal disease, a thorough deep clean, couple of x-rays, and maybe a composite filling in one of the tooth. So how do you proceed? What are the things that you need to keep in your mind? Don't you think bleeding gums could be a problem to maintain isolation, particularly for composite filling? So what you can do? Either do the composite filling first and then do the periodontal treatment, or else give 2 appointments to the patient. Do a proper deep clean, indices and everything, and then recall the patient for a composite filling in the later appointment once the oral hygiene has improved. Right, so this is just a small example that I have given to you. Now let's say the patient also requires a local anesthetic for this case. So what I would say is inject the local anesthetic first and then do the periodontal charting. So this will just give that sufficient time for the LA to start acting. So by the time you are done with the x-rays and maybe taking the indices for the periodontal treatment, the patient will be nice and comfortable, and then you can continue with the deep clean. Don't you think that if you are more organized, it will be more easier for you? Tip number 3. Plan ahead. I would say start with the more complex treatment first, because these will take a longer time compared to the simple treatments. So let's say that the patient requires a filling on the wisdom teeth. and also a couple of fillings on the anterior teeth. So what do you think that you should start first? I think it's best to start with the wisdom teeth, because if you start with the anterior fillings, possibly you will do the fillings very nicely, polish them well, but by the time you start with the wisdom teeth, the patient might be really tired keeping the mouth open for a long time, so it can create difficulty for you to gain access. So just really small things, but it makes a huge difference for you. Tip number 4, handle composites with a lot of care. Now, composites is one of the most widely used material for restoring teeth, but the problem with composites is that it's very sensitive to moisture. So you have to make sure that you're maintaining good isolation when you're doing composite fillings. If you think cotton rolls is not enough, suction is not enough, then go for a rubber dam, because if you try to cut down on that time, sooner or later that filling will come out. So it's best to do the composite filling while maintaining excellent isolation. And next, what you can do is try to shape the composite filling as far as possible before you cure it, so that you can save the time for later on for polishing or reducing it. Last but not the least, tip number 5, manage anxiety first. So whether it's a child or an adult patient, it's really important that you talk to the patient, assess their anxiety level, address their anxiety or concerns, reassure them, because of course a cooperative patient is by far easier to treat than an anxious patient. You can focus more on the treatment rather than on the patient. And of course it will save a lot of time, because if the patient is very anxious, they might try to stop you in the middle, they might ask you a lot of questions, so it will waste your time. So instead, I would say first manage their anxiety and then start with the treatment. Before I finish, one best advice that I can give to anyone is to maintain a handbook, a small notebook, just to note down anything new that you learned, or something that you found it difficult, or something you think that you could have improved on. So whether you are a newly graduated dentist or you are a practicing dentist for quite a while now, I think there is no end to learning. So definitely there will be days that you will learn something new and you think that you could have done it better. So by maintaining a handbook, you can assess your weakness, you can check that the lessons that you have learned, and basically this will allow you to perform better next time. And of course, as dental professionals, I think our aim should always be to improve ourselves and to deliver the best possible care to our patients. That's it for today. Thanks for watching. I hope you enjoyed and benefited from this video. If yes, please do like, share and subscribe to our channel. We'll be back next time with another informative video. Till then, take care. Bye.